So please welcome Senator Richard Natale.
G'day everybody. Well, firstly let me begin by acknowledging the Ngunnawal people as the traditional owners of the land on which we meet, and I want to pay my respects to their elders past and present. I'm not sure if Minister Lee or Catherine King's in the room, but if they're not, let me acknowledge their presentations as well, and of course thanks so much for the invitation to speak to you all today. And it's a real pleasure to welcome the Mary MacKillop Institute for Health Research back to Parliament House for another summit. You've done a lot of really important work in raising the flag on key health gaps in this country, and it's been a bit of an eye-opener for many of us in this building, because some of the issues that have raised here are not issues that we discuss commonly, and certainly are often hidden and overlooked by governments. This is, again, another one of those issues. The report Hidden Hearts, for which I have to really congratulate you, sets out a few sobering realities around the rate of cardiovascular disease in Australian women. It builds on a series of reports looking at cardiovascular health in Australia. I was really pleased to attend the launch of last year's report, which was Rediscovering Heart Failure, which outlined the significance of cardiovascular disease on the health of both men and women. Obviously, you know many of the stats. Heart disease kills one Australian every 12 minutes, it affects 1 in 6 Australians, and so on. But this report in particular is so interesting because those of you who don't know me might not know that I was also a bit like you. I was a medical practitioner, a doctor, GP and public health specialist before I started this gig. I had no idea that heart disease kills more Australian women than any other disease. You think that would be front and centre in terms of our training, and yet it was something that for me was a bit of an eye-opener, and it's that fact alone that should help us really sit up and take notice. You couple that with the report's estimate that 260,000 women, or 4% of those over 35 years old, are hospitalised with coronary artery disease every year, and then you've got over 20,000 new diagnoses with the subsequent treatment every year. So pretty remarkable numbers. And of course, we know with ageing population, with growing rates of obesity, with a whole range of other risk factors that are on the rise, that we're going to see an increase in those numbers. So very, very sobering. And yet, for too long, the sort of significance of cardiovascular disease on women's health has not received the attention that it deserves. So good on you for coming here and ensuring that this information is put before us as policymakers. What the Hidden Hearts report makes really clear to me is, despite the fact that now we know about the toll of cardiovascular disease on Australian women, we haven't got the appropriate data. We haven't kept up with what's going on around the world in terms of best practice, and that's got to have an impact on policy making. So you've got countries like Sweden and New Zealand where there's high quality national data that helps us to understand the burden of disease. We just don't have that rich and detailed data here in Australia, and we don't know this data in the detail that we need to. It's often fragmented, secondhand. We're triangulating from other sources and so on. So, it seems to me that the stats that are quoted throughout this report may, in fact, be conservative estimates, which is even more worrying. So it's a problem on a number of levels. It does mean that the effective policy response and the investment in that response is just going to be inadequate. I mean, you have to have the data on which to base these sort of responses. It's also a problem in terms of building awareness within the community and knowledge of the significant impact of cardiovascular disease on women. We know that women in Australia don't have, and I mean, if doctors don't, then we can't expect average Australians to have a full or realistic understanding of the threat to their health from cardiovascular disease. And so while cancers and issues like mental health rate highly as issues of serious concern to women in this country, cardiovascular disease is often overlooked, and that's a problem for all of us. So what the report does bring together is the serious impact of cardiovascular disease on women. It highlights the lack of reliable data and information about the impact of the disease and the serious disconnect that ultimately means that women are not fully aware of the risks that they face. And of course, there's the staggering information which highlights some of the true costs of the disease, costs in terms of loss of life, ultimately the most important indicator, poor quality of life, but also cost to the health budget. The annual estimated cost of hospital care alone, $3 billion. It's, again, remarkable numbers. And as I said earlier, as population ages and other risk factors increase, we're going to see an increase to those figures. We keep being told that one of the issues we've got in healthcare is we've got unsustainable spending. But as I said earlier today, when we launched the white paper from the Australian College of Nursing, sustainability is really, it's a value judgment. I mean, healthcare is unsustainable if you don't invest in it. I mean, if you don't spend money on something, of course it's unsustainable. The question, so this sustainability question is really a furphy. The most important question is, are we getting good value for money out of what we spend? And if so, we then have to make some choices about how much we want to spend. If we're getting good value for money, if our investments are based on good evidence, if we're being efficient in terms of the healthcare dollar, then why is it a bad thing that we would spend more on health if we get a return on that investment? And perhaps spend a little less on some of the other areas of the budget. We have, just for example, only an hour or so ago passed a tax cut for people earning $80,000 in this country. Now, when 20% of the Australian community earn over $80,000, but 80% don't, why is it that we would support a tax cut worth $4 billion that provides a handout to those of us, politicians, I suspect many of you in this room, who are earning $80,000 when 80% of the community misses out on that? And the cost of that is less investment in healthcare. That's one of the costs based on the choices that we make in this building. So don't buy into this nonsense that healthcare spending's unsustainable. It's only unsustainable if we choose to make it unsustainable. So yes, we have a challenge ahead of us to get as much value for money out of the healthcare dollar as we can, and we should continue doing that. I've been a supporter of the review of the MBS, for example. But let's ensure that that's just not simply a cost-cutting exercise, but is an opportunity to maximise value and to continue investing in healthcare. The report sets out a real challenge for us. It gives some pretty straightforward recommendations about what we need to do in terms of having an impact on this disease. And obviously, there's an investment there that needs to occur in awareness raising. It's critical that we as a profession are armed. My former profession sometimes lapse into that. I said today at the College of Nursing that if you want to learn what it's like to become somebody who was once in one of the most respected professions in the world and is now in one of the least respected professions in the world, go from being a doctor or a healthcare professional and become a politician. So we've got to do better. I think the medical community has to do better, but we obviously need to undertake a task of awareness raising within the community, and certainly ensuring that women are equipped with the information that they need. We know also, as I said earlier, that data is absolutely critical, and we have to do much better in terms of ensuring we've got reliable data on which to make sound decisions. A definitive study on cardiovascular risk and disease in Australia does provide you as researchers, us as policymakers, all of us with the information we need to do, we need to have to make the appropriate policy responses. In the face of an ageing population, prevention's got to be part of that story as well. And prevention's really slipped off the agenda here in Parliament. We did have a National Preventative Health Agency, and of course one of the first actions of the then Abbott government was to basically abolish it, which I think was such a retrograde step. For a party that prides itself on being economically rational, I just, for the life of me, don't understand why you wouldn't want to invest more in prevention rather than cut funding for prevention. But of course, one of the big challenges with prevention, again in this place, is often the benefits of prevention are gained over the long term, and we have people here who are fixated on 3-year electoral cycles. And of course, the other big problem with prevention in this place is somebody will come and complain if they've been waiting for 6 or 8 hours in an emergency department, or if they can't get onto an elective surgery list. But you won't hear from the people whose lives have been saved because of an effective prevention measure, because they don't know about it. They don't know that effective prevention means that they stay well and they aren't as vocal a constituency as those people who experience the immediacy of interacting with the health system and having an experience that's suboptimal. So we have seen, beyond the National Health Preventative Agency, we've seen cuts to the Flexible Funds program. Now, Flexible Funds, again, are a range of really important and effective preventative health measures. And again, we need to just reorientate our health system so that we ensure that prevention is at the heart of it. We also need to recognise that we've got a big task in terms of the primary healthcare sector. And with the emerging or the growth of chronic disease, and we know that the burden is increasing, as I said, for a range of reasons. Our primary health sector really isn't equipped to deal with chronic disease in a particularly effective way. And so, big challenge ahead of us to engage in sensible primary healthcare reform. We've got to move to a system that rewards people for prevention rather than simply throughput and service. Look, I think the trial on the medical homes is a really good thing. We support the government. We're worried, though, that it's under-resourced and that what we're going to do is we're going to see what is essentially a good idea that's working well in many other places that's effectively going to be killed by the fact that we have not had the investment in the trial that sort of significant reform requires. And there are a range of other concerns that we've got about that. Let me just say broadly in the reform space that we'll be keeping a very close eye on issues like medical home. We'll be ensuring that prevention continues to get the advocacy it deserves in this parliament, and to ensure that ultimately what we do is recognise that if we do those things, we'll have more to invest in a health system, and indeed make sure that it is sustainable into the future. I want to conclude by saying congratulations. Your work's critical to the work that we do in this place. You should be really proud of helping to bring this together and put this information in front of policymakers. You've highlighted a really critical issue, and again, as I say, the numbers are absolutely staggering. And if some of us who actually work in this sector aren't familiar with this sort of data, then it's no surprise that many women in the community don't recognise that this is a significant problem. Again, I'll just finish by saying consider us an ally inside the Parliament. If you have any specific issues that you want to prosecute, our door's always open. We have Senate estimates in a few weeks' time. If you've got any specific questions that you'd like to put, again, to the department, we're more than happy to be a conduit for those sorts of things as well. Thanks so much for your time.